So I'll talk just a little bit about this past week, which I know has been extremely difficult for our entire city, well, our entire state. So I know we're not alone in the things that we've suffered this week as a health facility. And I'm super grateful that there was no loss of life or anything like that for us. But it's just devastating how much damage water can do. And so our health facility, the fire suppression system, the pipes on the second floor in our dental office burst. And so it spewed waterfalls of water for I don't know how long. I don't know when it started. But by the time someone happened to go by, there was already standing water in our lobby and it was coming out the doors. So it completely flooded the second floor, came through the ceiling, down the walls. It was just flowing down the stairs as you went up the stairs. And it literally sounded like you were in a waterfall when you opened the door. It was just, it completely destroyed every single thing on our first floor, pretty much every single thing on the first floor. So everything that was on the first floor was a complete loss. But so we have regrouped. We're locating in several different facilities around the city. I'm here at Municipal Court's old building that's part of City Hall. Here with me, I have my admin staff. We have the WIC program here. And then we have our vital records, which is our birth and death records, located here at Municipal Court. And then at Mercy, we moved all of our clinical programs. So Coach, which is our city employee health clinic, has moved over there. We have our immunizations program, and then we moved our lab over there as well. And that's on top of the women's health services that we already did from over there. So they're all nestled in real cozy over there at our Mercy Clinic. Then we also have people at the Mockingbird Library, which has been closed to the public since COVID started. I actually have a lot of the Mockingbird Library staff that has been on board with me here at Health since almost the beginning of COVID. So they're kind of back in their old facility, but that's all of the data entry people, the scheduling people. They're over there at the Mockingbird Library. And then community services, which is attached to our health facility on the other side. Environmental health is located there. So those are all your restaurant inspectors. Our epidemiology people are there along with all of their staff for data entry, the COVID reporting. Our public health emergency preparedness data analyst people are all over there in that community services area. So that's where we all are in terms of staff. We literally met on Monday morning to make a list of all the basic stuff we need. We didn't have pens and paper and basic office supplies. So we're literally starting from nothing. So we're just asking everyone to be patient with us. We've slowly got phones on. Not everybody has a phone at this point. We slowly started to get some computers and some laptops and stuff, but not everybody has a computer. So we're still working to try to get people functional. So we just ask that everybody be patient. So I had staff go up there earlier in the morning on Tuesday, because there were some data loggers that were out that were, she was checking on vaccine and all of that. The building was fine. There were no leaks or anything going on that she could tell. I think I got the call somewhere around 1 o'clock or so in the afternoon, when someone had gone back up there and the facility was, filled with water. So sometime in between then and I don't know how soon after this person left that it happened. It looked like it had been going on for quite a while because there was extensive damage when I first arrived. So the estimated time frame initially, they said something like a month that we would not be in our building. Yesterday, the new time frame after they did much more extensive assessments on the facility is now 6 months. So we will not be able to be back in our facility for at least 6 months. They're thinking that all of the wiring, the air conditioner ducts, and all of that stuff will have to be replaced. They're doing a 2-foot flood cutout is what they call it. So basically everything 2 foot and down, they literally cut it all out. If you've driven by the facility, you've seen like all of the contraptions and things that they have. They're trying to dry it out. And so that just takes a while. And so we've got freezers on site, records, original dental records that had not been digitized. The dental office, like I mentioned, was ground zero. And so we have dental records that had not been digitized. And so they are sitting in a freezer truck. And so those are freeze dried, and they will start the restoration process on that later. But it's a painstaking process to go through every single item and determine, what the extent of the damage is. Do you need to keep this? How can we restore it if you do? We were able to maintain enough power within the building. We did have power outages, but we've got data loggers on those which communicate with our staff. And so it allowed our staff to monitor that. When it started to get out of range, we had staff who went up to the facility and took the vaccine out, put it in these special containers that we have, and took it home with them so that we could maintain the temperatures on those. Those have remained within temperature. We don't think at this point, we've still got some manufacturers to contact just to verify, but we don't think that we lost any vaccine at all.
Okay, one follow-up. How old is the building? Do y'all know?
I know exactly how old it is because I moved into it when I was pregnant. And so my child is now 15.
Okay.
And so it was December of 2005 when we moved into that facility. So it's not very old.
Last year, it's been tough for you guys already with COVID. I mean, you guys talk to us pretty much every couple of weeks. So can you talk about how it feels to have this building that you've spent so much of your time in?
Oh my gosh, you're going to make me cry because I haven't been able to talk about this without bawling. I think I went through every stage of grief. Just walking in the facility, I had my 15-year-old child with me. My husband and myself and my 15-year-old went down, and we walked in the door and I started sobbing. It was just incredibly sad to see it. And his eyes filled up with tears, and he said, "I spent my childhood here." And so it's devastating. It's like losing your home, so many great memories. But I know it's a facility. I've been through all the stages of grief, and I'm to the point now where I'm like, okay, I'm going to get a chance to pick the paint on the walls and the carpet and the flooring and all of that, which I love to do. And so I'm looking at the bright side now. And so it'll be okay. We'll get through it. But we had a lot of staff members who did the same thing. It's devastating to walk in and see it. Lots and lots of tears shed. We spend weekends and some nights, and it is a home away from home. We had our offices decorated the way we wanted, and it was homey, and it just, hard to see. But on the bright side, we are going to move forward with vaccination clinics. We'll be functioning out of the convention center as we have been. This week, we got our hub allocation for last week that was supposed to be delivered last week that never came. We got that this week, but we also got this week's hub allocation. So we have around 7,000 doses of Pfizer vaccine. So the plan is that we're going to host an initial dose clinic tomorrow at the convention center. We'll open up at 7:30. We've scheduled appointments for that, but for tomorrow's clinic, we will also have a walk-up line available. Remember that walk-up line does not open until 9 o'clock. And so we will start allowing people into the building to stand in line at 9 o'clock. So it's best to not show up, especially if it's poor weather, which is supposed to be colder tomorrow, I think, or a little bit colder anyway. But we won't open that walk-up line to be able to wait inside until about 9 o'clock. Then on Thursday, the 25th, we have the Pfizer booster dose. So this is the second dose series. This is for the people that got their initial dose on February the 4th. So when those people left their appointment on February the 4th, they left with their immunizations card, and it said the date that they needed their second dose. And we also wrote down the time, and it was the same time that they had their initial dose. So everybody should have their card with that appointment on it. Staff is not calling those people to let them know about that appointment. I don't have enough staff. I don't have enough phones at this point to make those calls. So we are relying on those people to remember that they have an appointment. We've tried to put messages on our social media and on our website to say these clinics are happening. That clinic, the second dose Pfizer clinic for Thursday, is still happening. And look at your immunizations card for the time that you should show up. Make sure you also bring your card with you. We won't have a walk-up line at that clinic because this is a second dose clinic. Those doses, all the doses we have for that day, are spoken for. So we will not have a walk-up line for the Thursday clinic. On Friday, this is the rescheduled clinic from Friday the 19th. So those people that were originally scheduled, they needed their Pfizer second dose. That has been rescheduled for this Friday, the 26th. We also, that clinic will not have a walk-up line. Again, because it's a second dose clinic, those doses are already spoken for. We've set the dates for next week's clinics. We'll have an initial dose clinic on March the 2nd and the 3rd. So we are planning to have walk-up lines for those dates. And then we will do a second dose Pfizer clinic on Thursday, March the 4th. Those are going to be for people that got their initial dose on February the 11th. And then on Friday, March the 5th, we'll host the rescheduled Moderna second dose clinic for those who were originally scheduled for February the 18th. The super exciting thing is that we're going to be testing our Inoculate software today. This is the software that allows people to schedule themselves. So what staff is doing right now is they're building the schedules in that Inoculate software. We're going to send it out to a small group of people that we've identified. They're going to be able to schedule themselves. We'll go in and look to make sure everything is working as we think it should. And as soon as we've got that ready to go, the plan is for next week's clinics on Tuesday and Wednesday. For those initial dose clinics, we're hoping that people will be able to schedule themselves. So that will eliminate the need for my staff to call out as many people to get that clinic booked. I do want to mention that I know we've got the waiting list, which at last check was somewhere in the neighborhood of 25,000 people. We will still have some people assigned to calling out from that waiting list. I know not everybody gets messages. There may not be people who are aware that they can schedule themselves. So we'll continue to have people work off of that list, but it's going to be much more efficient for everybody to schedule their own appointments. This also allows us, once they're scheduled in the system, if we were to have to cancel, we could send out a mass text and it would communicate with everybody quickly. And that would eliminate the need for my staff to contact everybody back and try to get these messages out. So we think that it will really improve efficiency. So that also when we do that, keeping in mind that a lot of these people are elderly and may not be able to schedule themselves. We think it's a fairly easy process because it's basically just asking you for a question and you either click a little circle, yes or no, or don't think there's anything that you actually type in unless there's a box that says, any special message or whatever. So it should be fairly simple, but I know it can be harder for the elderly to navigate. So again, we're asking for children or grandchildren of elderly people, friends in church groups and things like that, to get with your elderly loved ones and offer assistance. Even if they have signed up on our waiting list, we want them to go in and schedule their own appointments. So this will hopefully improve the efficiency. It is going to be first come, first serve, whoever can schedule themselves. And I get that people are like, but I've been waiting forever. I don't know of any other way to do it other than to just open it up and say, this is the new way that we're going to be scheduling. And again, we'll continue to kind of function off of that waiting list to ensure we don't leave people behind that did sign themselves up. And when we work from it, we're working from the top down. The first people that signed up, that's who we're calling. But we will make one phone call. If we're able to leave a message, we leave the message and we move on. We never attempt to contact that person again. If they don't call us back because they're given a direct phone number to reach somebody, if they don't call back to schedule themselves, they're off the list, we move on. So as soon as we can ensure that it's working properly, that we have programmed it right, because we have to go in and build the schedules and the appointment times, and we're still kind of playing with that. So as soon as we get all of that verified, then we will put it out publicly. The hope is that, and I've noticed that while we've been sitting here, the girl who's building the schedule has tried to call me and text me. So I think she may be finished with getting it built so that we can send that test link out. And so if we verify today that it's working, the hope is that we'll either send it out late today or tomorrow. If something is not working right and we've got to try to troubleshoot with the Inoculate IT people, it could be longer. Our goal is tomorrow sometime. Thank y'all. I appreciate it.